I would like to invite Dr. Deepak Vyas to introduce my another dear friend, Dr. Ketan Shah from Ahmedabad. So like he said, Dr. Ketan Shah from Ahmedabad, Dr. Krutik Shah from Anand, and me from Surat. But we have Dr. Deepak Vyas, who is from Nadiyad. So let us...
Here I would like to introduce Dr. Ketan Shah. He is an MD homeopath. Passed DHMS in 1989 and he passed MD in 2007. He is a very senior practitioner, practice homeopathy since last 30 years. He is also served as a professor in Ahmedabad Homeopathic Medical College and particularly subject with the Materia Medica. He is also guide and examiner for PhD and MD students. He is also member of ONGC panel. He is a National Executive Committee member of the Homeopathic Medical Association of India. He is associated with NJH, and he is also past president in HMAI Gujarat state branch, and he already served as an ex-principal in Arihant Homeopathic Medical College, Gujarat. So here I would like to say thank you, Dr. Akshay, to give me this opportunity. Now, Dr. Ketan Shah.
Hello, everybody. It's thank you, Dr. Deepak Vyas, for my introduction. I would be happy if I can see you, but it's okay.
Sorry, my camera is not working.
Okay, no problem. Okay, thank you. And thanks to Continuous Homeopathic Medical Education's platform, all members, and special thanks to Dr. Akshay Bankar for giving me this opportunity. My both co-speaker, Dr. Vrushali and Dr. Krutik, made this environment very energetic. Even my feet start dancing with tarantula. So without much wasting time, I just start presentation. Hope you are able to see my presentation. Are you?
Yeah.
Yes, it is seen.
Okay. Okay.
Thank you.
Here I am sharing one case, and after that, Materia Medica part of that remedy, and later on I will discuss the comparison with other remedies. So this is very acute case. A 49-year male called me on 17 August 2020. He want medicine for acute problem. He had coryza, obstruction of nose, and sneezing since last night. You all know, in August month, in India, it's monsoon. Causation of his illness was he exposed in rain. So this is the causative factor and simple case of coryza. Coryza and exposure to rain. So it was telephonic consultation, and my first prescription, I considered with damp weather and exposed in rain. I prescribed Dulcamara 30, 3 pills 4 times a day. Without thinking much about this case, just I prescribed Dulcamara 30. Second day morning, patient called me and told that cold and nose obstruction are same, and now I have 101 Fahrenheit fever. As Dr. Krutik told, that any new symptoms, you have to rethink medicine. Other symptoms with this fever, headache, body ache, fever with chill, and dry cough. Dulcamara Materia Medica part, just I want to discuss. Person who are prone to catarrhal, rheumatic and herpetic affection on account of exposure to cold and damp weather. Dulcamara affects on mucous membrane, producing excessive secretion. In Dulcamara, what are the aggravate factors? Being chilled while hot. When you expose in sun or exposure in heat, and immediately if you expose in AC or chilled place, then you get cold. That's the causative factor of Dulcamara. Even sudden change of temperature, cold wet, cold drinks, ice cream. We know that Dulcamara is remedy who are working in cellar, because in cellar dampness, humid atmosphere is there. Even cold feet, hot days and cold night toward the close of summer are especially favorable to the action of Dulcamara. Complaints better. As we know, Dulcamara is rheumatic remedy. So rheumatism is better by moving about, better from warmth or dry weather. What are the nose symptoms of Dulcamara? Dry coryza, complete stoppage of the nose, stops up when there is cold rain, profuse coryza, and any cold air causes aggravation. It causes obstruction of the nose. So patient kept the hand in front of nose, so warm air can inhale in the nose. Coryza of the newborn. So these are the nose symptoms of Dulcamara. Now, fever symptoms. Coldness in different part. Icy or paralyzed part when there is a pain. Chill start in the back, not better by warm. Worse in the evening. So chilliness is there and it's on the back side, not better by warm. Chill with urging in stool and urination. Foul sweating. Chilliness with the thirst. So after studying Materia Medica of Dulcamara, I thought that Dulcamara is right medicine. So I asked him to continue Dulcamara 200 in water. In acute case, many times I dispense medicine in water. I ask my patient to take 100 ml normal water, add 10 pieces of globules, of medicated globules, and you have to take 1 spoon every 2 hours. This is my method in acute case of repetition of the medicine. So I advise patient to continue with Dulcamara 200 now. On third day, he again called me. Today, third day, and situation become worse. Fever is still increasing with chilliness. Cold and nose obstruction is slight better, but fever was increasing. And patient was very anxious because of COVID. Are you sure, doctor? I have no COVID? Not this patient. Nowadays, all the patient with 1 day fever, same question. Are you sure, doctor? I have no COVID? On third day, I advise pathological investigation, CBC with ESR, C-reactive protein, S-ferritin, and urine routine and microscopy. When there is a fever with chill, I always ask patient for urine examination, because many times with urinary tract infection, same symptoms like a malaria. So you misguide for malaria. To avoid that, urine routine and microscopic I advise. What is the importance of lab test? Its help in diagnosis. If it is normal and family members are relaxed. So if reports are normal, family members are relaxed. And we get more time for medicine action. We can buy some time, 24 hours or 36 hours for our medicine action. Third day evening, from my side, I was sure about medicine Dulcamara, but it was not working and condition going to worsen. So time to rethink of case and need to change medicine. As my friend Dr. Krutik told, you have to wait for few hours only. But here I was waited for 2 days, and now on third day I decided to change medicine or rethink to the case. Now I become serious, and now case taking through video call. On video, I saw that patient was lying down with covering because of chilliness. Chill more during the evening time, around the 5 o'clock, 5 p.m. I found too much weakness in comparison of the third day of fever. Appetite less, thirst absent, sweating absent, but body ache and extremities pain, even headache are present very well. So no thirst, no sweating, but body ache and extremities pain with headache present. What is the advantage of online consultation during COVID? No pressure from waiting room patients. You can spend as much as time you want. You have enough time to study the case, even selection of medicine. And I did that. I considered following symptoms: weakness, fever during, chill, not better by covering, patient complains pain in extremities, so pain in long bones, fever, chill, aggravate at the evening time, complaints from damp, rainy weather, perspiration absent, thirst absent. On fourth day morning, all blood test and urine test within normal range. What I consider it now: weakness during fever, complain in rainy and damp weather, chill at the evening time, and body ache, leg pain. This is my entry point. I consider it these symptoms, and I prescribe Aranea Diadema 30. My friend Dr. Rushali coincidentally described the same case of migraine, of headache, of Aranea D. But both contents of this remedy in my lecture also, it's very different from what she described. And this is the beauty of homeopathy. I prescribe Aranea D in water repetition, 1 spoon every 2 hours. From 5th day, start improvement, and on 6th day, patients feel good. Fever came normal, weakness reduced a lot, chill and body pain also under control. Now, this is the Kent repertory, weakness, fever during, because I consider this rubric in this case. Total 22 remedies are there. 3 mark arsenic and phosphorus. 2 mark remedies fever, weakness during fever, Baptisia, Bryonia, Ignatia, muriatic acid, acid phos, Netramur, Pulsatilla, Rhus Tox, Robinia. And Aconite, Entomtat, Aranea D, Carboe, Jupetorium prepurium, Ferrum, and Lyco, and few more. One more rubric, Weakness, fever after. Only Aranea D, only remedy in 2 marks in Kent repertory. Weakness after prolonged fever. Selenium is only remedy in 3 marks. So, after considering all that symptoms, I prescribed Aranea D and I got good result. Now, I am discussing about Materia Medica part of Aranea Diadema. It is Papal cross spider and whole living spider is used because of why this name, from the yellow and white crosses on its back. Whole live spider is crushed and macerated in alcohol and prepared the medicine. After mating the female, usually blinds, kill and eats the male. This is the nature of Aranea female. Just I want to play a small video how this female behave with male after mating. Hope you can see the video.
Yes, it is visible.
Okay. See, fighting of female and male. And now she started binding the male. See how she binds male spider. Male spider is finished now. Now, Materia Medica part or Aranea diadema. It is hydrogenoid constitution. Means abnormal sensitiveness to the damp and cold places. Inability to live near fresh water, either river or lakes, or in damp, chilly places. So, hydrogenoid constitution. Complaint aggravation from bath, from damp weather, damp localities, worse drawing in cold air. So, dampness, humid things aggravate the problem. Another important, chill and neuralgic attack. Periodicity is most markable. Same hour, every day or every other day, week, month and regular periods. So periodicity is well marked in Aranea D. Even in our case, chill aggravate at the evening time. That's the periodicity. 4 p.m., 5 p.m. That's the periodicity. My friend Dr. Rushali described these symptoms, and on this ground, she prescribed Aranea in migraine case. Confusion is better by smoking in the open air. Smoking betters the symptoms. Some sensation in these remedies. What are the sensation? Sensation of swelling in many parts, head, face, hands. Feels that this limb become double than normal size. Even parts become heavy, as if bones were made of ice. This is the sensation of Aranea. Temperature symptoms are very important. Coldness with pain in long bones. This is also another entry point for this case. Cold all the same time, cannot get warm. So cold all the time feels chilly, cannot get warm. Chilly as a bone made of ice even in summer. That's much chilliness that patient feels that bone made up of ice. Chilliness after being in water. Chill with clock-like regularity as clock strike for daily. This is the periodicity. Mostly use this remedy in malarial fever, long-lasting chill, chill without thirst, sweat or heat, great exertions, desire to lying down. Weakness is very important in Aranea. It is hemorrhagic diathesis. Hemoptysis. Why hemoptysis? Because cancer of the lungs. Hemorrhage from many parts from the wounds. Even it is good remedy for punctured wound. Abdominal symptoms. Swelling of the spleen after intermittent fever was suppressed by quinine. When fever suppressed, particularly intermittent fever, suppressed with quinine and spleen enlarged, you can think of Aranea D or Chinium Sulph-like remedy. Enlarged spleen with chilliness. Fullness and heaviness in the abdomen from a stone, just like a bryonia, there is a heaviness. Female symptoms. Menses too early, too profuse, distension of abdomen with lumbosacral pain at the end of menses. Pain at the end of menses. After copious menses, at the end of menses, there is a lumbosacral pain. Even lumbo-abdominal neuralgia also there in Aranea D.
Sorry to interrupt, Dr. Ketan. We have 5 minutes.
Okay, I will finish within time.
Thank you very much.
Okay. Side of the body, right sided. Toothache is very important. Toothache, sudden and violent at the night time, immediately after lying down. At the same time, this is the modality of toothache at the night time as soon as lying down. Which are the remedy? More than nearly 150 remedies in Kent repertory. Wet weather worse. Aranea, natrum salt, Dulcamara, Rhus Tox, Nux moschata, and rhododendron. Now I want to compare few remedies. Cedron. Cedron, rattlesnake bean, but it's not from snake group. It is from plant kingdom. In Cedron also periodicity is very important. It is good remedy for malarial affection. Malaria of warm, damp, marshy countries. See, what is the difference between Aranea? Aranea is for cold, damp weather, and Cedron is for warm, damp weather. This is the difference between Baki. Or otherwise, all symptoms are very common: periodicity, malaria, neuralgia, and complaints after the sex. Fever at the 6 p.m. with chill in the back. This is the Cedron. If I would not study that remedy after that case, rethinking, I may prescribe Eupatorium after the Dulcamara, because Dulcamara is bone set, bone pain with malaria and influenza, and this patient was complaining about bone pain. Great soreness of the muscles and bone, dengue fever, marked periodicity, chill between 7 to 9 a.m. in Eupatorium, chill, aggravate in the morning time, and sweat relieve all symptoms except the headache. Sleepiness during fever. I use these symptoms very frequently in my fever case, that sleepiness during fever. No doubt other remedies are there, but eupatorin is one of the remedy. I cured one chikungunya case with this rupri. Great thirst for cold water. Rhus Tox, as you know, it is wet weather remedy. Complaints from brain get wet after being heated. Stiffness of the muscles and joint. We know the modality very well. First motion aggravate and continuous motion ameliorate. Restlessness is there. Tongue, tip of the tongue is triangular red. Urticaria during the fever, influenza and typhoid fever. So I consider this remedy because of the wet weather and stiffness of the muscles and joint. Arsenical, burning, better by warmth. Restlessness, this medicine also very restlessness, but weak to move. Thirst for small quantity in frequent interval. Tongue white coated, and we know the time modality 12 to 2 a.m. and p.m. This is last comparison. We can think of China because chilliness, influenza with debility, malarial fever, chill, heat and sweat stage. In our case, only most of the part is chill stage. But here in China, chill, heat and sweat stage. Chill, then thirst, then heat and then thirst. This is the cycle of chill, thirst, heat and thirst. Drenching sweat at the night time. And in China, chill generally in afternoon, forenoon. And Chinyam Sulph, chill at the 3 p.m. and thirst in all stages. So I end my talk here. Wish you happy Diwali. And again, thanks to all organizers for giving me this opportunity. Thank you, Akshay.
Thank you very much, Dr. Ketan Shah. It was a very sweet presentation of Aranea Diadema case. Again, we have seen Aranea since morning, which is interesting because we can see various facets of the same remedy. Another thing that I normally am interested to see what are the types of symptoms that are included, and that gives us a confirmation when we take those symptoms as forming a totality, and then if the patient feels better, then we can be sure of those symptoms as clinical symptoms also, and the results can be obtained. So it gives a confidence to a homeopath, and it gives confidence to all of us who are listening to you, who are shown results like this. So thank you very much. It was a good differential you gave with other medicines of hydrogenoid constitution. So that was very nice. Thank you very much, Dr. Ketan.